Hello, everyone. Welcome to today's webinar, Policy at the Pace of Innovation. We apologize for the slight delay, but we are going to go ahead and get started. So I am going to give you just kind of a brief overview of CSG South before we hop into today's presentation. So one moment, please. Alrighty, so I'm just going to give a brief overview of CSG South. So CSG is a nationally based or a national organization that's regionally based. We were originally founded in 1933. Um, we have four distinct regions: the East, Midwest, West, and South, as well as the Justice Center. CSG South was established in 1947. You may know us better as the Southern Legislative Conference, which is our annual premier conference that we hold. We have different departments within CSG South: the Policy and Research and Programs Department, Marketing and Communications, Strategic Partnerships, and Events and Operations. Our funding comes from state appropriations. So 60% of our funding is of state appropriations goes to CSG South, 40% goes to nationals. We also receive funding from private sector organizations, grants and foundations, and those sorts of funding opportunities and strategic partnerships. So if you are a state official in any of the three branches of governments, you are already a member thanks to your state's state appropriations. This is just kind of an overview of our organization. So we are led by our regional director, Lindsay Gray. And then I am part of the policy team. So my name is Erin Toomey Parton. I'm a policy analyst under the direction of Jill Clark, our Director of Strategic Partnerships, Policy, and Programs. The vision of CSG South is to be the most indispensable partner in cultivating resilient leaders, solving complex challenges, and shaping an impactful future for state governance. Our mission is to champion collaboration, leadership, and innovation across Southern state governments by equipping public servants with trusted, nonpartisan resources to drive informed and effective policy that strengthens states. Here at CSG South, we value ambition, adaptability, servant's heart, accountability, and credibility. So within the policy research and analysis, we have 6 standing policy committees. Those are Ag and Rural Development, Economic Development, Transportation and Cultural Affairs, Education, Energy and Environment, Fiscal Affairs and Government Operations, and Human Services and Public Safety, which I am the liaison for the Human Services and Public Safety Committee. We also provide information requests. So if there's something that your office would like us to research and find out more information on a certain policy, you can use this QR code or access our information request submission form through our website. In addition to our policy information requests, we produce policy publications as well as testimony for committees during session and study committees during the interim. We are currently in our state visit season that we do state visits during session. So this week we were in South Carolina. Next week we're going to Kentucky. We are visiting 14 of our member states this year. We also provide domestic and international delegations. Some of our programming that we do each year, we do professional development as well as staff resourcing. So we have our Staff Academy for government Governmental Excellence, our Center for Advancement of Leadership Skills, Policy Masterclasses, and our Chiefs 15X, which is a Chief of Staff Leadership Retreat that we launched this past year. We also have our LSA, which is our Legislative Service Agency Directors Group, and our Staff Alliance for Intergovernmental Leadership, also known as SAIL. Speaking of policy masterclasses, this year our 2026 course catalog includes masterclasses on child welfare, STEAM education, and data centers. If any of those three spark your interest, you can sign up using the QR code on screen or by accessing it through our website. Strategic partnerships. We partner with multiple private funders, including foundations, nonprofits, and other organizations. This is just a list of some of the partners that we have. Notably, the Casey Family Programs Foster Care Collaborative, Pew Energy Modernization Roundtable Series, and the Living with Water Netherlands delegation that we did a couple of years back. So I mentioned earlier the Southern Legislative Conference. This is our premier annual conference that we hold each summer. It's the nation's largest regional gathering of legislative members and staff. This past year, we were in Birmingham, Alabama, where we hosted around 1,400 people at the legislative conference. We had 41 sessions offered, including keynotes, policy sessions, government staff tracks, committee meetings, site visits, and other fun additives to that. We have a robust guest and youth program in conjunction with policy and government staff sessions. And we also have a philanthropic project that we do each year where we pack meals. And this past year, we packed over 100,000 meals. So that's awesome. We love being able to give back to the community that we're hosting the conference in each year. This year, we're going to be in Lexington, Kentucky from July 11th through 15th. So save the date. Registration is now open. You can register on our website. After the webinar, if you have trouble accessing that, please reach out to me. I'd love to help you find that. Today, we are hosting a webinar as part of our webinar series, Policy at the Pace of Innovation. We are joined today by Senator Bo Watson, who represents Tennessee's 11th District, which includes northern Hamilton County and parts of Chattanooga. He currently is serving his 5th term and is chair of the Finance, Ways, and Means Committee, as well as the creator of the State of Tennessee's AI Advisory Council, as he is also a member of various other committees in the state of Tennessee. Senator Watson has been practicing physical therapy for more than 30 years and is the Director of Sports Medicine and Therapy Services at HCA Park Ridge Medical Center in Chattanooga. So without further ado, I'm going to stop sharing my screen and pass the baton to Senator Watson for today's presentation. Thank you.
Thank you, Erin. Can you hear me well?
Yes, we can hear you.
Perfect. Well, thank you for inviting me to be here today. I really appreciate it. Do you have my slides with you that you'll be able to bring up for me?
Yes, absolutely.
Great. Again, to the audience, thank you for joining in. And of course, to the Council of State Governments, the Southern region, thank you for inviting me. I look forward to the hopefully what will become a conversation after a brief little bit of introduction here. Obviously, there is a lot of interest in artificial intelligence. I have served on a number of task force over the past 3 to 5 years where we have been looking more and more at artificial intelligence along a number of sectors. But particularly, there is a lot of interest in how AI operates in the healthcare space. So today I wanted to take a few minutes of time, and I appreciate the Council of State Government Southern Region allowing me the time to talk about some of the things that are happening in the southern states, particularly in Tennessee, when it comes to AI and our healthcare systems. First of all, most states have created advisory councils. Some states have very broad advisory councils on artificial intelligence. Other states have created smaller councils on specific areas like AI councils on healthcare, AI councils in education, AI councils in business. Every state is wrestling with the AI phenomenon of how much do we regulate it. I know we now have conversations going on about whether it's federal government regulating it, the states that are regulating it. States are very interested in regulating and their role that they have in regulating artificial intelligence in all the various business sectors. Many of these AI councils are really in the phase of learning and developing information to help legislators and the government better understand the role that AI plays, not just in the governmental space, but also in the business and private sector as well. Within the healthcare space, I wanted to take a few minutes and talk about some different buckets that you might think of artificial intelligence being in. And then at the conclusion, have a conversation with Aaron and then open to any questions you might have. First of all, in the clinical environment, you have AI, which has really taken root in the healthcare space. Clinically, we have been working with electronic health records since probably the 80s, advancing in the 90s. And of course, the 2000s, everybody started converted, and most everyone in healthcare systems are converted to electronic health records. The construction of the electronic health records now allows for much more analysis of the data using artificial intelligence programs. But even further than that, electronic health records have allowed artificial intelligence to use things such as ambient evaluations, where the practitioner comes into the room, has a conversation with the patient, not really taking any notes, listens to the patient's history, listens to the patient's story of their situation, does their diagnostic evaluations. All of this is done while AI is listening, and amazingly, the practitioner leaves the room and the artificial intelligence has already developed a note in the format that that practitioner utilizes. It offers diagnostic suggestions, treatment suggestions, even will print the patient's prescriptions and any instructions that the physician might have for the patient. Totally automated. The reason this has been being studied and is so successful, it increases the efficiency of the practitioner. It still allows for the practitioner to review the note to be sure of its accuracy, because we know that artificial intelligence and those type of systems is not 100% accurate, but it's getting better with every passing day. As we look at these kind of things, states have to ask some questions. Are we comfortable with this? Is the public comfortable with this? Are the people that we represent comfortable with this? Most of those kind of things at the state level are going to be regulated by the professional boards that have jurisdiction over a particular health provider. In this instance, it might be the Board of Medical Examiners in the state of Tennessee that would help define the rules and regulations of how electronic health records might utilize these ever-developing artificial intelligence platforms. In terms of clinical applications, we are seeing artificial intelligence in the healthcare systems applied at the bedside with patients, being able to monitor patients, not only monitor patients while they're in the hospital, but now we have applications where patients can be monitored remotely. We have companies that are developing what are known as in-home intensive care units, where artificial intelligence is able to monitor the patient's progress or the patient's condition and able to alert the providers if the patient's condition worsens or if there is a important turn in the patient condition that requires human interaction or artificial intelligence interactions. Again, these kind of things, although they're developing in the scientific space of clinical applications, states and the boards which govern all of these different professional groups, professional providers are going to have to pay attention to how these applications get executed in each of our communities. And finally, large hospital systems. I'm a member of I work for a large hospital systems, are using AI in terms of monitoring operations and efficiencies. Hospitals are able to use artificial intelligence, analyzing data to predict length of stay, can predict comorbidities of patients, can help predict which rooms are available and not available for post-surgical cases, as well as for patients that need rooms, can communicate and coordinate with their remote locations like freestanding emergency departments. And all of this information can be siphoned through the artificial intelligence who is able at a much faster rate to disseminate the information and get the information into the right provider or into the right clinician's hands. These kinds of efficiencies would be seen as lowering overall cost, but also increasing productivity amongst all the providers in the healthcare continuum. Again, these kind of things have to be monitored by state agencies such as departments of health or even commerce and insurance who have regulatory authority over many of these kind of applications. The next bucket is AI, and this is really for providers are looking closely at this, and particularly agencies like commerce and insurance within state government is how is AI used in the insurance world and in the reimbursement, which is really important, obviously, to providers. A lot of discussion in the insurance world about utilizing AI in claims processing, its ability to look at massive amounts of data and make objective decisions in terms of whether a claim is appropriate or not appropriate. It has the capability of weeding out waste, fraud, and abuse at a much faster rate than humans can. At the same time, it is objective, and it doesn't necessarily at this point have the ability to truly analyze each individual case. And so most states, when insurance companies are using AI, and virtually every large insurance company are looking at how much human interaction should be involved in the claims processing, particularly when it comes to claims reviews and appeals. When a patient or a provider's claim is denied or downcoded in the review process, states are looking at how should AI be involved in that review process and how much should a human have input. Most states are leaning towards, well, AI may be able to do the initial, but for the final review, it needs to go through the hands and through the eyes of an actual human reviewer. So for those of you looking at AI in the insurance space, I think this is a space where states are really going to lean in to look to be sure that AI is treating the beneficiaries fairly, treating the providers fairly, and that there is an appropriate review and appeals process for individuals who feel like the system has not treated them correctly. AI in the regulatory environment, and this is where government probably is going to lean in the most, but also just within the healthcare system space itself. Healthcare systems are regulated by the Joint Commission on the Accreditation of Hospitals and other types of regulatory agencies such as that, which do large audit reviews, do large data analyses of hospital systems or other types of systems. But states also, through their health departments or through their departments of health, have oversight and regulatory responsibility to the healthcare market, particularly through audit and record review. And so I think you will see, and we have seen AI really leaning into being able to process large amounts of data in audit review. Again, it has the ability, when properly prompted, to pull in waste or identify waste, fraud, and abuse. And at least highlight that again to a human reviewer. I think every state that's looking at this is adding in a component that there has to be at some point the human touch and the human eyes on any review that AI may have done. Record reviews, because of, and this actually refers back to us earlier talking about electronic health records, record reviews are a key part of the regulatory environment. And AI has a role to play, actually a large role to play in being able to analyze and review large reams of records in a very quick manner of time, and pointing out to regulators where problems may exist. Again, where states are weighing in on this is that at some point in that continuum of analysis, a human set of hands and a human set of eyes need to be on the record. And finally, perhaps one of the most promising areas in the regulatory space and in the science space is the data analysis. The ability of AI to analyze large amounts of data is going to allow us to develop and progress in not only our diagnosis of patients' conditions, but also in advanced treatment of patients' conditions. It's going to result in the specialization of healthcare to where certain conditions, because of a particular genetic profile, are going to be treated with specific pharmaceuticals as opposed to others. I know that virtually every state is in the discussion around biometric medicine, biometric pharmacology. AI will play a huge role in that. And again, at the state level, much of how that AI is implemented and utilized will be at the level of the boards, which have the responsibility for oversight of the different professional providers that they themselves regulate. But in the data analysis space, AI's ability to analyze the data at such large volumes is really creating incredible opportunities in science and research around health improvement, and particularly around public health, where we will now in the future have the ability to analyze large groups of public data and offer strategies that may be more effective than in the past. But again, states look at this from the perspective of their constituents, and their constituents want to be sure that at some point along the continuum, human eyes are involved. The last bucket for us in the public space particularly is the public's view and concerns and their interest in artificial intelligence. And I title this, artificial intelligence in the public square. Most of the concern that states, as well as our federal government, are looking at are privacy concerns. AI's capabilities are enormous, but it also has the capability for invasion into individual, particularly in healthcare, patients' private records. And so states are trying to build in systems, as well as the vendors are trying to build in systems that be sure that we protect the patient's privacy at all costs. Privacy and security in some ways go very much together. We know that all of healthcare systems are under constant attack for data mining by usually malfeasant organizations or entities. AI, again, has the ability to process and deal with large volumes of data, but ensuring that that data is secure is a key component of the development of cybersecurity. And AI has a very large role to play in the cybersecurity space, and states need to be guaranteeing the public to the best of their ability that the AI systems that are being utilized sustain and maintain both privacy and have been built for incredibly tight security, which leads to data control. I think the public is certainly interested in how AI has application in the healthcare space, but they're concerned about who has control of the data, and who controls the patient's information or the health system's information or the insurance information. And so states are looking closely at policies that ensure that while we're containing privacy, we're ensuring security. We also are maintaining as to who has to actual control of the data and who has access to that data. And finally, probably the area that will create the most conversation as artificial intelligence moves forward is, from a healthcare perspective, the most important part of healthcare and dealing with other humans is that it is informed consent. What does that mean in the modern world? What does that mean in terms of individuals' data as it's moving through this artificial intelligence space that's ever evolving and creating? And patients should always have the option of making choices about not only the healthcare that they provided, but also the records that healthcare provision creates, and who has control of that record, and is the patient aware of all the individuals or all the groups or all the insurance providers who have that information. And patients should also always have the opportunity to choose where that information is provided through an informed consent process. Informed consent is already complicated for patients, whether it's about clinical treatment or it's about insurance information or provider information. It will get more complex as AI is introduced. And states are going to have to look at their current laws and policies around informed consent to be sure that the patient, the constituents that we represent, are always protected and always have the opportunity to be informed about any treatment they may receive or any information that they may release. That's a quick overview. I'd certainly open to any questions or additional comments that folks might have.
Well, thank you, Senator Watson, for that presentation. At this time, we'd like to firstly apologize that we were not able to show the presentation in full screen view. We've had some technical difficulties on the back end, but we really appreciate your time and your expertise on that. Now, I'd like to invite any of our participants to submit any questions that you might have for Senator Watson. In the meantime, we do have a few pre-submitted questions that we can share. So, so our first pre-submitted question is from someone who's asking about stories that have recently been in the news where people are using AI, not healthcare providers, as diagnostic tools. Have you heard of any discussions or policies that have been enacted that are trying to mitigate AI usage for diagnostic by an individual who is not a healthcare provider?
Fantastic question, and a really important question because the access to information through artificial intelligence, whether it's chatbots or whatever it might be, is going to proliferate. We recently just passed a law in Tennessee, moving to our legislature currently, regarding, particularly in behavioral health, regarding counseling and counseling through chatbots, and prohibiting any kind of chatbot that purports itself to be a behavioral health specialist without actually being a behavioral health specialist. Those kinds of things are difficult to follow. It's going to actually require artificial intelligence within our security systems to help monitor and root out those kinds of bad actors. They're going to continue to proliferate. We're going to rely on platform administrators to help monitor that. But I think every state probably is going to develop legislation and policy and laws that prohibit the utilization of artificial intelligence by non-licensed practitioners. It brings in a whole new question, Aaron, on licensing. If a healthcare provider has the ability to use AI, how does AI get licensed in our traditional view of? And licensing is a purview of the state. We have said in Tennessee that you cannot license an AI entity. It had only a human, as we know, humans can be licensed. But it does beg the question of, does some of these AI type platforms become subjected to licensing to where then you have more regulatory control over the information that's being provided to the clinicians? Again, I think professional boards will lean in heavily on this as it starts to develop. But that is a great question that we're all wrestling with.
Yeah, I think that's something that throughout the rest of the session and even going into next session, we're really going to be seeing people trying to tackle that. And your comments about licensure really bring up a great point about every state does licensure different. And to that point, we have another question about how President Trump's recent executive order entitled Ensuring a National Policy Framework for Artificial Intelligence, how that plays into how states are regulating AI in healthcare. For those that are maybe a little less familiar with the executive order, it's basically laying out framework guidelines for AI regulation. So, how do different state AI regulations play into that national framework?
Yeah, well, it's going to be challenging. I mean, obviously, I'm a federalist. I believe that this is actually a function, licensing and this regulation should be a function of the state. Tennessee has been doing some regulation in this space in other sectors outside of just the healthcare space for about 2 or 3 years now. And we think that the work that we've done has been really effective, and we continue to work at it. We recognize that that because of the interstate play that AI and other types of technologies have, that it's easier to have a national platform. But just because it's easier doesn't mean that it's the best way to do it. And so I would continue to advocate that this is a responsibility of the states. Now, that being said, I think states are going to have to look at coordinating and collaborating their policy development, their legal development, along with our federal partners. What I have said in previous conversations about this is that, as we all know, those of us that are in state government, states are much more nimble and able to move much more quickly than our federal government is. And because of that, I think the state's ability to regulate is much more important than the federal government's. I'm afraid that at the federal level, that by the time the federal government has looked at a regulation, that the technology has already moved on beyond their ability to really regulate it, because it's moving at such a fast pace. Even the states are struggling. It's moving at such a fast pace. I worry that there will be gaps in the regulation, and that patients' information will get exposed before the states and or the federal government has a chance to really fully respond. But we're going to have to try and coordinate with our federal partners until this all resolves itself out. I know that a number of
Gotcha.
states, I know I keep chiming in, but I know a number of states, have sued over that we believe this is a responsibility of the states and not of our federal government.
Gotcha. And, I think that this is a conversation that's going to be, lasting. As you mentioned, this is new, right? We're still trying to figure out how exactly we approach this topic. And in that vein, we actually have a question from the chat where someone says, we've seen a few instances where lawyers or other legal staff get caught relying on AI material that was inaccurate. Um, it's early in AI usage. We haven't perfected AI yet. It still kind of hallucinates or misinterprets things that it's pulling from. Um, have there been any cases, to your knowledge, with medical licenses or medical practitioners about a practitioner defaulting to AI as a diagnostic tool and then maybe it misdiagnosing, and what does regulation look like in that space?
Yeah. So to my knowledge, I'm not aware of any. I would not doubt if some have happened, but I'm not aware of a particular instance. Throughout my discussion or my presentation, I kept referring to the fact that most policymakers, if not all policymakers, believe that somewhere along the continuum there has to be human hands and human eyes on the medical record, on the recommendations that AI may generate. Uh, in many instances, people have been advised to look at AI as an assistant, but ultimately, you have to make a human has to make a decision about what the final decision will be. Certainly, AI can give a health practitioner a lot of options to think about, but it is through the practitioner's training, education, and expertise that they determine which of those options are the best option for that particular patient. Quite honestly, Aaron, the biggest challenges that healthcare providers are having with artificial intelligence is the patient who walks into the practitioner's office with something that they have downloaded from Grok or ChatGPT or something, and the patient actually having more faith in the artificially intelligent created recommendation and diagnosis than the practitioner standing in front of them. That's the big challenge because patients often, particularly patients who have difficult diagnoses that are looking for any kind of solution, will often bring into the practitioner something that has been created by artificial intelligence somewhere that they saw on their computer, and in essence, challenging the practitioner in terms of whether the practitioner is correct or whether artificial intelligence is correct. And that is creating a lot of challenges for practitioners because patients want to follow the instructions of that which they believe most. So if they believe the chatbot more than they believe the practitioner standing in front of them, the practitioner has to spend a lot of time trying to convince the patient of which treatment is the best. That leads to a lot of potentially damaging self-treatment, where by the time the actual clinician has a chance to treat the patient, their condition may have deteriorated.
Gotcha. Well, thank you for that. I also um, wanted to ask if you could maybe discuss a little bit more on specific policies that you're seeing on the insurance side of things. We have someone in the chat who is asking about insurance companies using AI services to deny claims and what kind of policies you've heard of or discussions around maybe potentially looking into bad actors in the healthcare insurance space to help protect consumers on the front end of the claims process.
Yeah, I think every state in the South is looking at this really closely because of the volume of claims that insurance payers receive. Obviously, using a technology which can process those claims really quickly is something that they're going to do. Now, on one side, it's going to potentially help lower the cost, at least on the clerical side, lower the administrative side, lower the cost of some of healthcare insurance. On the other side, virtually every state is looking at are these technologies being used in order to deny claims unjustly, or are these technologies truly just being used for efficiency purposes? That's why most states are putting in, either in law or policy through their commerce and insurance agencies, the opportunity, and I discussed this earlier, that at some point along the continuum, a human has to be able to be involved. Now, using AI, I think about 90% of most claims get paid. But those 10% that are denied, or those 10% that are reviewed, that is where I think policy and law steps in and says, hey, if you're going to deny a claim, deny someone coverage for something that they have paid, that they believe they've paid for, then you have to have a human that adjudicates that final decision. So I don't think you'll see much of a change in the process in terms of how that happens currently, where humans meet with humans. I think up until that point, you will see insurance companies trying to use AI really to just process most of the claims that actually will get paid in the end.
Awesome. Well, thank you, Senator Watson, for providing such a insightful and balanced answer to that question. We really appreciate your expertise and your time today. Not sure if we have any other questions in the chat, so I'll give a last call for questions before we wrap up today's webinar. Okay. Hearing none, Senator Watson, again, thank you so much for being on today. You've had some great insights into the AI policy space, especially with healthcare, and we really appreciate you hopping on today. And we are going to wrap up. So thank you, everyone.
Well, Aaron, thank you very much. And I really appreciate the opportunity. I do want to say that I think every state is wrestling with how much, and our federal government as well, how much do we regulate so that we don't stop, but at the same time, we don't stifle creativity and innovation. And in this particular space, that's the balance we're trying to strike. So thank you very much for allowing me to be here. It's been great.
Thank you. All right. Well, I hope everyone has a great rest of their day and a safe weekend. And if CSG South can be of help to anyone, please reach out to me directly or access our information requests online at our website. All right. Thank you. Bye bye.